Quarters. You got any? In your car?
I don't have nothing.
How you know if you ain't look? You have money thrown all across your floor sometimes. And that's what, let me go check my vehicle. Myra, I gave her money. She don't even know what quarters at.
Hey there, how you doing? I'm just waiting on everybody to join in. I'll start at 8, okay? I'll start at 8. I'm just on here early to start up. Hey there, how you doing? We getting started for 8 o'clock, okay? I'm just on here prepping up right now for me.
Dr. Clark told me that you were coming. Let me give you a tour. Great.
Get a pup.
How's it going, Angela?
AT&T's internet works in minutes. It's so easy a baby could do it.
Creed?
Whose baby is that?
It's okay, I asked.
Who?
A baby. Why is there a baby in here? We're setting up the internet. This is the internet. It's just part of our job.
Make sure y'all have y'all manuals out too. If you don't have your manuals, have a notebook. You gotta have something so I can give you these note-taking skills so you will know how to have your book prep. Even if you don't have your manual, just have a notebook or something so I can be able to still share my notes with you all so you will know what to do.
Yes, Billy. Billy wants to know, are you a real, honest, goodness, detective stranger?
See, I'm trying to see how to prop this phone up. Can y'all hear me pretty good?
Here's my proof.
Oh, let me show you how to sign that.
Can y'all hear me?
That's easy.
Proof. Ouch.
I don't see no responses. Can y'all hear me? Hey there, how you doing? VGS. I'm at work, I'm listening. I can hear you. Okay. Okay then, thank you. I appreciate that. Thank you. I got my phone propped up, so that's why I'm asking. I just wanted to make sure I wasn't muffled. And for those who don't know, you guys, I've been sick, so my voice is kind of hoarse. If you don't understand something I'm saying, please put it in the comments and let me know. You did? Hey, that's not bad. 5 points is not bad. You know what that means? You know your stuff. That's all that is. You know your stuff. Did it tell you what sections you missed? VGS D. Hey, well then you need these tips then. If you ain't got your book, if you ain't got your manuals, you need to have a notebook or something, because what I'm for to do, I'm giving out tips now. So you gon' need that. I will be doing practice test questions in the live so you all can get an understanding what's gonna be going on. I have no book. Alright, appreciate that, Bama. What is that, Bama? Bama. Yeah, I got some stuff in here for y'all because I want to make sure y'all understand how this go. It's real simple. Don't stress over it. And to be honest, missing your test by 5 points, man, that's a blessing, to be honest. Some folks out here missing it by 10 and 15. Nowhere near that passing score. So, you know, that's a blessing at the end of the day.
I got a problem. That female ranger's with him all the time. I can't get to him.
I guess you just got to keep up with them.
Thank you all. Our pleasure. Ranger Gage is an excellent student.
Got a good partner.
Oh, and your lip reading has come a long way.
Thank you.
Especially when it comes to understanding compliments. So, Gage, what are your plans?
Get back to work.
Well, we are all sad to see you go.
You have all been an inspiration to me.
I start with anatomy and physiology and medical terminology. So I've been looking for these tips. Alright, so you want to do anatomy? What is that? Physiology and medical terminology. So VGS, let me tell you something. With your medical terminology, and I like your concept of it too. Because honestly, oh, it's 8 o'clock. Alright, so honestly, with those right there, those how I start out. I start out with my medical terminology, my anatomy, and then I go on down to my coding guidelines, compliance and regulations. I do all of it in that order. And the reason why I do that, because it helps me. So once I do it in that order, I turn around and I go ahead and go to once I finish all that little first few sections, all the way down to the 10,000 series, then I turn around. I went to I bypassed the 10,000 series, and I started going into what was that Hicks picks and anesthesia. I did E&M last, but I just wanna do it this way to show y'all what I'm talking about, because we're going to do some test questions up in here as well. I'm going to help y'all with test questions, showing y'all how to work my method, okay? Because there ain't no point in showing you the method, like telling you about it, if I can't tell you how to apply it, all right? So that's one of them. So we're going to do that. So starting right now, I'm starting with the integumentary system. And the reason why I'm starting with that, because I want y'all to go ahead and take these notes down. So for the integumentary system, you need to write in your book, notebook, manual, wherever you want to write it. I prefer you to have a notebook if you ain't got your manual. So you need modifier 25 for the integumentary system, 10,000 series. You need modifiers 25, 50, 52, 58, and 59. You need those 5 modifiers.
Sure do. That's the better put me in here. Care to elaborate? Yeah, hell yeah. That's totally valuable.
Anything dealing with Hicks Picks level codes for the integumentary system, you need code G0127. That's a code by itself. G127. The next code is G0168. If you don't understand what I'm saying, I'm going to show y'all too, just in case. Now, I want to make sure y'all understand where I'm coming in. With good morning, how you doing? So, again, that first code is, let me show you. There you go. This is where I'm looking at it. You need these modifiers, all right? Modifier 25, 50, 52, 58, and 59. Make sure y'all putting this in the back of y'all integumentary system. I don't care how you write it down. You could just write down modifier 25 and then, list it as the numbers. But, when you go to Appendix A in the back of your CPT book, you can determine what's what from there. I always put the Hicks Picks code in there too, because guess what? On that test, they're going to ask you questions dealing with certain systems within the surgical area of the CPT book, and you need to know where to go to if they start trying to put these type of codes with that test question answer. Are y'all able to see it? I'm going to leave it there for a second for y'all so y'all can copy it down. And I'm going to tell y'all something else. So, as I'm leaving it there, your whole method dealing with note-taking for book prepping. Let me show y'all how this go, all right? Give me 1 second. So, are y'all familiar with concepts? If y'all can, put yes, no in the comments. If y'all familiarize with concepts, so I can be able to explain it to you all what concepts are. Because this is very important, and you're going to need this for your test-taking skills. All right. What they say? But mom, you got no. All right. Anybody else know what concept is? All right. So for concept, your concept is going to let you know how to code that selection. All right. It's your coding selection. You need to know how to code it. What it mean is, and I'm going to show you. I'm going to move this out the way. Y'all should have been able to gather that a little bit. This is what concept is. This is what it look like. You see my highlighting? You need to be highlighting your concepts. This is also what your concepts are. Your coding concepts for the integumentary system is depth, size, device, number, complexity, with and without. That is how you need to be dissecting your codes. This is how you dissect your codes. You need to know the size. You need to know the device. You need to know the number. You need to know the complexity. And you need to know, hey there, Tamara, how you doing? And you need to know if it's with or without guidance. So y'all, I'm going to show y'all how this go. So right here, in the first part of it, I'm going to show you this. Give me 1 second.
I'll be fine.
In the first part of it, and I'm going to show y'all something too. Let me show y'all this because I want to make sure y'all know what I'm doing out here. So for y'all who don't know, if y'all missed this live and you decide you want to buy my ebook, I got an ebook out that's dealing with the CPC exam review, all right? And it started off with the integumentary system, and guess what? I go through each section within that section, you see? So starting out, this is how I go. Now, this is just a preview of my book. I'm showing y'all what I do. So for the fine needle aspiration, FNA, you are reporting to collect fluid, tissue from cysts or mass. Your coding selections, which is your concept, is with or without guidance. That means imaging, ultrasound, fluoroscopic, CT, or MR. And you need the number of lesions, all right? So this is how I highlight it. I highlighted the fine needle aspiration biopsy because that was important to me. I need to know what I'm dealing with. I needed to know if it's with or without imaging guidance. As you see, with or without guidance, right? And then first lesion. Remember, you got to code the number of lesions. So this needs to be in a separate highlight. With or without guidance need to be in a separate highlight. And your number of lesion needs to be in a separate highlight. I always put a tip in for you all so you all can understand. So with the FNA tip, you need to pay close attention to the parental note following the FNA codes. This directs you to other codes when specific and anatomic sites require an FNA, as you can see down here. You see, they providing you with other codes. This is just part of my book. Thank you so much. So I wanted y'all to see this is how that's going. Make sure y'all liking the live too, because this help the other people that missing this right now to know that this is up. Some people be forgetting or they at work. So if y'all can't, at least try to like the live a little bit. So this is just my example. I'm showing y'all right here. This is how my book look. It gives y'all examples on the chapter section. It tell you a brief description. I give you concept. And I give you a photo to show you what I'm talking about. And then I give you a tip. You see that? This goes all the way through, you guys. This is just for the integumentary system, all right? Now, this is for sale. This is for sale. So when y'all get ready to start, want to buy, then hit me up. But I'm showing you. This is how you code your stuff. I'm going to go through the next page so y'all can know. All my stuff is like that. I highlight with or without, and I highlight the number of lesions. Every section within this CPT book has a concept. Even for the musculoskeleton concept, you got a concept for it as well. So that's why I said it's gonna be kind of quick, but let me show you. All right, did y'all get y'all modifiers and Hicks Peak notes? Cause y'all need that. I'm heading to the musculoskeleton now, cause that's really all it is. Y'all have to have that to know what's going on. 1 second, let me get this for y'all real quick. Alright. Musculoskeleton. Here it is. Your most common modifiers used in orthopedic surgery is bilateral, which is modifier 50, modifier 54, modifier 57, 58, 59, 62, 66, 78, 80. You familiarized with these, right, y'all? I don't think nobody really needed to know what these are. Y'all should be very familiarized with these. If you're in school or if you self-paced, you know, they give you these. But I think your main concern with the modifiers, you need to know what modifiers to put in each section. Because they're going to ask you that on the test now. They're going to throw a modifier in there. You need to know which modifier goes for that section. And please use common sense, you guys. If you in the 2000 series, the 20,000 series of your CPC exam, don't be using modifiers that I did not show you on here within that section. Cause that's how they triple you up. They triple you up like that. Using stuff to distract you. Alright, so let me show you. Let me show you the concept of it. Give me 1 second. And for y'all who don't know, AAPC do have a coding concept. This is what their documentation look like for coding concept. You got a type, you got an anatomical site, you got a size, number, time, complexity, with or without, depth, device, modifying factors, time, age, site of service. And I'm going to tell y'all something. This is very simple when you get the hang of it. The more you sit there and you try to ponder on what's going on, this is the only way to get your answer to your code. This is the only way. If right now they were to ask you a question on FNA, I'm going to just make up a question. Let me go back to it. The integumentary system. If they were to make up a question on that right now, how you gonna answer to that? How you gonna respond? So, can y'all, if you have your manual, somebody put in the chat for me, the comment. If you have your manual, a patient needed ultrasound guidance with the first lesion. What number that is, y'all? What code that is? If you got your manual, tell me what the code would be. Ultrasounding guidance is a with or without. So it's including ultrasounding guidance and one lesion. So how is that going to go for you? Which code would that be?
Did you bring my diamonds? Yeah, I got them.
Thank you, Tamara. Anybody know?
Place them on the floor and step away. First, let my partner go.
Anybody know? Nobody know?
I let him go.
I'm gonna show you then. I don't see no chat. This is what it looks like. 10005. Ultrasound and guidance with First Legion. I'm gonna tell y'all something else. If you on the test and you trying to struggle to find what a medical terminology is, write this stuff down in your book. Let me show you that too. Let me go back for you. Let me go to these. Right here, this is your integumentary system. You need to write these down. This is your integumentary system. Even if you can screenshot it, do so. You can screenshot it. Some of y'all at work, screenshot it. No, you ain't got to do all that writing, screenshot. This is your medical terms that you need to be putting down in your book for that section. Medical terms for that section. Hey, Dante, how you doing? You got the musculoskeletal system. These are the terms that you need for that section. I'm fine. How you? And it goes on to this side too, y'all. I'm going to do the whole book so y'all can see. Y'all screenshotting. Make sure y'all screenshotting if you have to. This is how they go. And if y'all think about it, I'm actually giving you all the main hookup. Because you got to purchase this book. This is a book. Hey, up V773. Thank you for being here. So I'm giving y'all the answers. This is your medical terminology section. Every section has its own words you need to be writing down. It has its own words that you need to be writing down. Because guess what? On the medical terminology section, you don't know what they're going to ask you. It was a trick question that they asked me. And I'm going to say trick question because they threw it at me in a loop. They asked, what is the prefix term of the word sub? Now, the word prefix of sub is not in here. I'm going to just be honest with you. It's not in this book. It was in this book. Can y'all see it? It was in this book. That's how I knew that they're going to be triple you up on some things. But it's okay. The same way you see that I did this. I got the integumentary system right here. I put it right in front of my notes in the surgical section. And I made sure I point to, because guess what? They're going to ask you about this too. They're going to ask you this. If y'all have not took that test yet, make sure you are in the loop with Trich, because it means hair. They're going to ask you that. They're going to ask you about the SEB. That's why I pointed to everything so I can know what's what. And it's the same thing, y'all. So, again, for those who just joining, I'm going over medical terminology and anatomy review because I want y'all to understand each section has its own terms, and you need to have these sections down. If you can't write fast enough or listen fast enough, there's a such thing called screenshot. I'm going to put it to where you all can see it without the comments being in the way. Let me know if y'all, it said, did you do your own notes? Yes, Miss Rachel, I did all my own notes. See? I do all my own notes. And this is how you pass your test. And I'm going to tell you something else. I'm going to show you what I've been doing for y'all. But you got to purchase it, though, all right? Still for y'all, but you got to purchase it. So, give me 1 second. Right here is what I've been doing for y'all. I came up with this whole system for y'all. It gives you an example sheet of the integumentary system. Fine needle aspiration. I give you a chapter section. I give you a brief description of that section. And I give you the coding selections of how to concept that code. What that means is dissecting. Thank you. Thank you so much for following me. Girl, take my test for, hey, good luck. You gonna get it. You gonna get it with this. I'm telling you, just make sure you screenshotting everything, because you never know how these phones do. And you never know how stuff get done. Sometimes, you know, they'll turn your live off. So make sure if y'all can't write fast enough, screenshot. So this is how I did it. This is an ebook for you all for the integumentary system. Your code selections are based off with or without guidance. And I gave you an example of imaging, ultrasound, fluoroscopic, CT, and MR. You have to get the number of lesions. I gave you an example in the picture below. As you can see, these are my notes. You see? These are my notes. That's how you know I did this myself. I also put a little note in here for you all so you can pay attention to the different codes, because you need to know when it's talking about a specific anatomic site, so you will know not to be coding for the wrong thing, all right? This is what it looks like. That was just my example page right here. So when y'all get ready to purchase this, now it give you everything you need to know, basically. And it teaches you how to highlight your book. Whether you want to use the same highlight colors, you can. If not then. But you need your own setup. You need your own method. My whole purpose of this is to teach you all how to get this started. I'm going to give you basically what I had to do when I was trying to take my test. That was to understand the concept. You need to know the CPT documentation's concept. You need to know what a type is. You need to know what an anatomical site is. You need to know what the size is. You need to know the number, time, complexity, with or without, the depth, if it have a device, modifying factors, time, age, and site of service. You all need to know that. So basically what I'm doing is, in this section of the integumentary system, I go through each section with you all, and I give you the coding guidelines of how to dissect your code. This is what I'm doing. I'm giving you the coding concept of the guidelines, how to break down your codes. Because when they ask you a question on the test, you need to be making sure you're looking out for imaging guidance. You need to be trying to figure out if it's with or without any type of guidance. You need to know if it's amount of lesions. You see what I'm saying? They're going to ask you these questions, but you need to gather the concept of everything. You know what? And that's okay. Because on this is my personal ebook, y'all. My ebook. I created this ebook, and it breaks it down. It say I struggle with the guidelines and code order. And that's all right, Miss Rachel. Because guess what? This right here helps you. It's simple form. It ain't all this words and bull crap. It's very simple. And you can also write this within your code book too, if you wanted to, like your CPT book. If you wanted to, you can write in the front of your section of that selection, and you can put with or without guidance. And then you can put number of lesion. This will help you to select your codes. But if you highlight it like I'm showing you on here, then you won't have a problem with finding what you need when it comes to test taking. Sure, no problem. And I'm going to be showing y'all today as well how to, hey, that's good, that Lady G. And I'm proud of you. I was self-paced. I had to self-teach myself. Seems like teachers these days don't want to help nobody. I had to come to the realization of that on my own. So I'm giving y'all the golden ticket right now on how to pass your test. But you got to understand the concept of it. Appreciate that, 787. Hey, that's what I'm talking about, that Lady G. We in this together. Don't worry about it. I got you. Only reason why I'm showing y'all because I seen so many of us failing that test. Everybody failing that test. We trying to figure out how is everybody failing that test, but that's okay. I'm going to show y'all. You need help with CM coding? Also, self-pay going to trouble. I understand that. Hey, that's Toya B. Appreciate that for coming across here. Yes, I am. That's why I'm teaching y'all how to get certified as well. Teaching y'all. Who was that said that? Let me see. V773. I'm gonna go over guidelines probably around about 9 o'clock if you want to come back at that time. At 9 o'clock, I will be going over the ICD-10 CM guidelines so you all can get an understanding of how to search through it, okay? Because y'all got to understand how to navigate. All right, then. I appreciate that. And y'all, just let me know what y'all trying to do so I can help you to not waste time if that's possible. Or having to take it like 5 times. What was it? I just got volume back. Oh man, Miss Rachel. Hey, I feel like I'm talking to what was that that little cartoon show for these kids been Rachel. I keep seeing her name Rachel. I don't have the books or anything. I'm trying to get back into my classes. That's fine if you don't have the books or anything. Look, screenshot what you need to screenshot. I've been telling y'all through because I know y'all at work. I know some of you all are busy. So if you can screenshot what you can. Let me see, can I zoom this out a little bit? There you go. This is a quick little note. If y'all can screenshot that, that'll be good. AAPC has the program that will help you pay for tests if failed. Yes, V773 they do. I put that on my content page as well so y'all can see how to apply for that. You will need to call them so you can apply for that. I post being certified, but I've been allowed too many distractions. And you know that happens sometimes. That happens sometimes when you get distracted. Hey, sometimes, you know, God warning you. Sometimes it be something up ahead on that road that you don't know nothing about. You can't see it spiritually. That's all it is. Sometimes it's better to be delayed. That's just being honest. I can't tell you how many times things that have happened to me within my careers, and I still had to fight for it. I fought for it. I fought to be here. That's why I call myself the entrepreneur, because I invested so many financial struggles within everything I'm doing. Alright, so y'all. So again, medical terms. Screenshot if you have to. Integumentary system has its own terms. You need to be writing that down in the book like I did. Find you a spot in your book, whether it's in the front, the back, or even do this section got note taking? Yeah, I got some notes back here. You got a note page back here. You don't have to copy my notes, but I'm just saying, you know, you got a note page back here. You can write those medical terms down. These are your medical terms for the integumentary system. And let me show you your modifiers. You need these modifiers to go into your integumentary system. Let me I'm holding my phone too, y'all, so if y'all trying to figure out what's going on, that's why. These are the modifiers. You need modifier 25, 50, 52, 58, and 59. Just in case they might throw a little code at you with the Higgs piece. You need to know that too. This is the training manual from AAPC itself. That's why I'm able to pass that test. You all got to get there too. So that's why I'm showing y'all how to navigate through your book. But to be able to navigate, you need to know the actual codes. You need to know how to consult. Yes, I recommend getting this book, but I'm gonna tell you right now, if you ain't an AAPC member, I don't know how this gonna work out for you. You need to be able to call them and ask them to put it in your cart so you can pay for it. My book was supposed to be like $109, but with taxes and everything, it came out to be $130 something to be shipped off and everything. So for the musculoskeleton, and I'm gonna show y'all something else. Keep flipping back and forth, but that's all right. These are just in case y'all missed it. These are your coding concepts for the integumentary system. You need to screenshot this if you don't have it. Screenshot if you don't have it. This is for the integumentary system. Let's see here. For musculoskeleton. Your coding concepts are anatomical site, size, number, complexity, with and without. Yes, that's my baby in the background. My mama got her. See, we runs laundromats. We have laundromats, so that's why y'all see me at the laundromat. But I'm up here taking the time out trying to make sure I show y'all this for those who actually want it. Yeah. Yeah, so this is the coding concepts for musculoskeleton, y'all. So y'all make sure y'all take that down. Musculoskeleton. This is for the musculoskeleton system. You need to be taking down an anatomical site, size, number, complexity, with and without. You guys, there is an AAPC sheet that shows you your concepts. Here it is. If you don't know what an anatomical site is, it's the location, procedure, or the service is being performed. That's how you do that. Now this is important, and this is what I was showing you when I was telling you about trying to actually code, like dissect your codes. This is what I was talking about. What I just showed you right here with your coding concepts for AAPC, this is how you dissect your actual codes with this. And what I'm showing you, the coding concepts for each section, is why I'm doing it. So you will know what's what. And this is how it's supposed to look when you dissecting your codes. You need to be dissecting with a highlighter, with or without guidance. You need to be dissecting with number of lesions, with a different highlighter. When you see these right here, the add-on codes, you do not have to put add-on codes right here. I be seeing y'all write that stuff, But you don't have to write add-on code. It's a plus sign right there. You know what a plus sign is. It means add. So you don't have to write it down. I be seeing a lot of these folks in their lives sitting up here circling all these boxes on their books. That's stupid. Don't be circling all them boxes. What you boxing stuff for? Don't do that. You gonna get confused, because when I looked at it, I got confused. I was like, what you boxing all that stuff for? And then she was like, that's to separate the procedure, because this is this. You don't need to do all that. You automatically gonna know, do you have a site I can watch a replay of this live? No, I don't. I don't have a site, but what I can do, after I get done with this, I can try to put it up on YouTube. Like, I'll take a video of this, not a video, but download it, and then thank you, y'all. And then I'll go ahead and put it on my content page, and also make sure I put it on YouTube for y'all. Thank you, Cheryl. Thank y'all for supporting. I appreciate that. I appreciate that. So y'all, I'm just giving y'all the actual concept of each section. Now, if y'all want to really support me and y'all really want to pass this, yes, I did self-study. Toya B, I did self-study. Self-studying is best study. Because you know what? We are, as medical research, as medical building coders, we are medical researchers. Yes, I did with AAPC. We are medical researchers. We tell a story. That's what we do. We translate the story behind that patient into codes. So it's important to understand what you're trying to do. And the only way you're going to be able to understand that is through consult. And that's why I'm showing y'all how to dissect. This is what dissecting look like. You see my color coordination for the highlighting? That is what dissecting look like when you go through each code and dissect it. But it's a concept behind it. You need to know how to concept these codes individually. This is how you do it. With this section, it's with or without. And it's a number of lesions that I'm looking for. I appreciate that. I appreciate that. Nah, I don't think I need to be no instructor. I get too many ignorant people sometimes, so I don't think I need to be no instructor. I did, Ma. I was trying to help some of these folks. They started, no Lord. Oh, okay then. Oh, no, you don't need that. You don't need no instructor unless you want to pay for that. You don't need one unless you want to pay for that. Now, I'm going to tell you right now, if you paying for that through AAPC, they going to do you exactly how they do all the rest of us. Nobody's on screen with you. Nobody's on the screen with you virtually. All you doing is going on there and doing everything on your own. They give you all your coursework on there, and then that's it. Hey, Miss Rachel, don't have test anxiety. It's about, yes, there is a place to buy my notes. I'm going to put them up for y'all later on today. Put them up there for y'all later on today. So be watching out for it. Miss Rachel, don't have test anxiety. I'm going to tell you right now, the only thing that can keep us away from what we really want is us, because we are our own enemies. We are our own worst enemies. We stop ourselves. We hold ourselves back from our blessings. So don't be nervous. Don't be frustrated. Don't be weary. Don't let this get to you, because it's so simple. It really is. Oh, no, I ain't get that. I did not get that. If you want now, me personally, I don't know, cause they didn't close our libraries down here, so I don't even know. I don't even know if they had it. Oh man, for real? Ain't nothing like somebody who can't stand their job. They say just. What they say? For each section, now I'm gonna do it like this. For each section is $80. Each section. Like, so I'm doing the integumentary system, it's $80. And the reason why it's $80 because I'm breaking it down. I give you all the modifiers that you need to notate for that system only. So you will know. And I'm also give you the Hicks Picks notation, so you will know for that section only. You will also have all the coding sections for this system only. And you will have my image of my book, the images that are actually in my CPT book. Now, if you're trying to buy the whole system, all of it together is $300. So you got to think about it. If you pay for it in $300, you're still saving money. But just for those who just need specific systems, that's why I'm doing it. Because I'm actually giving you the answers. But you got to be smart on how you put it in your book. Some people don't think about that. Where's the ebook to purchase? I am from Mississippi. Yeah, you can hear the accent. I'm gonna put it on Etsy. What is that? Timberneat. I'm gonna put it on Etsy so y'all can purchase it. Ohio in the building. All right now. So yeah, y'all, it's about concept. I'm gonna give y'all this as well. This is the concept. It breaks it down for y'all on what the concepts are. And from there, once you start understanding through my integumentary system, everything else gonna come to y'all like clockwork. I'm so serious. And I'm only leaving it like this because the rest of it's for sale, y'all. I don't want to give y'all too much of it, and I won't, profit nothing from it. But I want to make sure y'all understand right now on how this go. So, so for the musculoskeletal system, I'm going to go ahead and finish up with y'all. Because I told old girl 9 o'clock, didn't it? Let me go here. Here you go. Musculoskeletal system. These are your modifiers that you need to write down or screenshot. Modifier 50, 54, 57, 58, 59, 62, 66, 78, 80. L codes and E codes for Hicks Picks are for the musculoskeleton. No, Cheryl, concept is how you would dissect your code. Like this right here. This is concept. Because I had to understand the concept of this code. You understand? I had to understand the code. So the only way I understand it if I go through the concept of it. The concept was with or without imaging guidance. But this is without imaging guidance. And it's about the number of lesions. So this is the first lesion. That's what I mean when I say that. Now, your guidelines for CPT, this is a guideline for you all. This is what guidelines look like for CPT. And your ICD-10 book, you just got to go to the front of the book. Because everything is in the front of the book for y'all with the ICD-10 book. Anything dealing with CPT, this is a guideline. This is a guideline. You see what I'm saying? It's telling you how to code, what to look for with certain areas. That is what a guideline look like for the CPT book. Or you can go to your table of contents. Don't let folks say this is a guideline. This is not a guideline. This is table of contents. That's another way to help me pass the test too, because when they were talking about hold on, what this? Oh. Okay, that's another thing that helped me pass the test too, was when they were asking about subcutaneous skin. I already knew to go to here. So I went to this page, 86. I went to 86, right up in here. And all I needed to do was just look for what I was looking for, whatever that test question was asking me. You need to be paying attention if it got anything dealing with guidance in there, drainage or catheter. You need to be like making sure that when the test is asking you something, you have those things highlighted. Like over here, you need to know if it's simple or single. You need to know if it's dealing with anything dealing with abscess, cyst, or hematoma. See, y'all gotta understand it's a concept behind it. So that's why I was telling y'all, when it comes to book prepping, you need to know your concept. And that'll be there for y'all too. Thank you, Tamara. Hey there, Tori. How you doing? Thank you, Tori. So yeah, I'm just showing y'all how to get your book in order. The only way you're gonna get your book in order is by understanding the concept, and this is the concept. Every section of this book has its own concept. So when I tell y'all what I'm doing for y'all, it's not only gonna benefit you, but you're gonna guarantee pass the test. But you gotta be willing to understand these. These are your definitions for the concept. So this is what it means when I put type in there. So if I were to say your concept is dealing with the type and the size, this is what your definitions are. It refers to what actually being done, such as an excision, removal, or induction. And it says is inherent to every single code. You see that? And then the size is length or width or joint. So if I was to go to fine needle aspiration, I'm basically looking at with or without guidance, number of lesion. So there go with or without, imaging guidance, manipulation, supervision. You see what I'm saying? And then where's the number is? There go number. How many are being performed? So if you need help with understanding what the concepts are, it's in my actual book for the integumentary system. But see, I got all the systems. And this is to help you out in each one of them. And I'm going to show you something else just to show y'all. So when I broke this down for y'all, I'm going to just show y'all this little extra page. So on my page, I let y'all know how to break the concept down. So basically, you need to understand that concept is an abstract ideal or a general notion, and it's a plan to intention, right? Meaning you will look up your code for the CPC exam. You will need to know the concept of what you are looking for within the CPC exam question. The questions you need to be asking is, how would I code for this question? You need to be asking, is it with or without? Is it talking about the anatomical site? I gave an example, body parts. Is it asking about a size? Those are concepts that I'm asking about. You see what I'm saying? That is how you code for your codes. Because remember, your CPC exam is based on guidelines and navigating through your CPT book. You need to know, because, and I'm going to tell y'all something. Don't let these folks out here that doing medical building and coding, work from home, or in a physician office tell you all that it's about coding. Your CPT book is 80% of that test. So it's important for you to gather this concept. It's important for you to understand the concept. And it's important for you to understand how to go in and navigate through your CPT book. That's why you see that I got notes on here, because that was the only way for me to pass the test. And some people took that test 12 times. Some people still don't understand how to go through that test. You see what I'm saying? This, like right here, if your book was empty, you would highlight subcutaneous tissue and then first 20 square cm or less. You see right here, you ain't gotta highlight this because we already know we in debridement, right? If we in debridement, it's gonna say debridement. Debridement, debridement, however you wanna say it. It's gonna say it. But this is what we talking about. The subcutaneous tissues, they got a code for muscle and fascia. And each one got their own lesion, right? And make sure you always highlight this in a different color. When you see it in parentheses that say include epidermis and dermis, if performed, then that's what you need to be looking for. I'm actually giving y'all the answers right now. And the only way that's gonna work if y'all understand. Do y'all understand what I'm putting down with this? It's a concept thing. Alright, respiratory, hemic, lymphatic. Let's see. These are the modifiers for respiratory, hemic, lymphatic systems. Modifiers. You need to screenshot it if you can. Modifier 22, modifier 25, 50, 51, 57, 58, 59, 79, and modifier LT and RT for left and right. Appreciate it, Cheryl and Dana. Now, let me go to the respiratory system so y'all can get the concepts for it. So respiratory and cardiovascular. The concepts for it is, give me 1 second. Anatomical site, device, number, complexity, with and without. I could watch you every day. I'm currently in medical coding school and you break it down easily. I appreciate that, Trina. I appreciate that. I'm trying to make sure y'all understand so y'all can pass that test. Cause you gotta understand your coding concept is what helps you pass the test. This is y'all coding concepts for respiratory and cardiology. Hey there, Sheila. Thank you for following me. Appreciate that. This is the coding concept. Did y'all get it? Good morning. How you doing?
Good morning. How are you?
Alright. That's for respiratory. Alright, so let's go here to digestion. Digestion is pretty simple. I'm going to show y'all something real quick. Please screenshot these. Y'all need to put this in y'all notes. This is small intestine. That is a test question. This is a large intestines. Y'all, they gonna ask that. Please screenshot, put it down in your notes. However, they're gonna ask you that. That's a test question. This right here is a test question. Alright, so Dana, you know what I'm talking about then. You ain't no strangers to this then. You know exactly what I'm talking about. They gonna ask y'all that. Let me show y'all something else too. Up in here for the cardiovascular system. Please highlight this. This is on your test. Cardiac valves. They're gonna ask you about the cardiac valves. I think they're gonna have all these on here except for this one. I think. I can't really remember. It's been a minute, but I know for a fact they're gonna have all this on there. One thing about me, when I took that test, I made sure. Yeah, I do some crazy stuff, but I'm gonna say it like this. So when I'm taking a test, I do this. That's how I do it when I'm taking a test. That way, if I don't understand something, I go back to it. Because, you know, you can't highlight nothing while you're taking the test. You can't write nothing while you're taking the test. Everything's supposed to be already in your book already. So that's what I do. I fold a page up so I can come back to it. And that's how I take my notes. Or I do something like this, make a little dent with my nails, you know. That's how I do it. Let me see. Respiratory. Take this down if you can. This is a practice question. Practice test question. This is a practice question. Practice test question. That's a practice test question.
I see you. And you. And you. Putting in the work. Day after day. In you. I see me. Someone rising to the challenge. I see your determination and strength. I see your unshaken
Alright, let's go to the digestive system then. Because we gotta go ahead and get the modifiers for it. I will. Cardiovascular. Let me get the modifiers for it first before I head off to the next one. Okay. Here are the modifiers for cardiovascular. Modifier 22, 26, and TC. 51, 58, 59. Not done yet. Modifier 76, 77, 78, 79. Please get your HCPC level codes because you're going to need that. You're going to need it for the cardiovascular. This is for the cardiovascular system. And besides, the the title of it is up here too if y'all trying to get the pictures and stuff. Alright, let's see here. Digestive system is pretty easy, y'all. Digestive system. If they asking you anything about a lip, that's where you need to be going to then. If they talking about a tongue, that's what you need to be doing. You need to be heading over to the tongue. This is how you use your content, your table of content. If they talking about anything dealing with the esophagus, you just go to them pages. And that's how you look it up. If the question got something in there dealing with excision or incision or endoscopy, you go to the code range and there go the pages right there. That's how you quickly get to where you trying to go to with that code range. A lot of us was taught to go to the back of the book for your index. No ma'am, no sir. Who for to do that? All that flipping pages and stuff. You can't do all that, because guess what? Your test is 2 minutes per question. I don't really think so, because to be honest, I made 100 on my 2,000 and 3,000, 20,000 and 30,000 series. I made 100 on those. It's about concept. Again, y'all got to get these concepts down. When you get your concepts down, you will understand how to code. Your concept is basically how you dissect each code. That's all your concept is. Your concept is the understanding of each dissection of a code. That's why I was telling y'all in my content videos that you need to be able to go, you need to take a week or two in each section. I don't care if it take you a week for radiology. You need a week for radiology. A week for path and pathology. You see what I'm saying? Take you a week or two and get these codes dissected. Each section need dissection of the codes, because that's the only way you're going to be able to get the concept. Again, your concept is what helps you to understand the dissection of your codes. So, I just want to make sure I'm making that clear for y'all. Book prepping is not taking notes from out of somebody else's notes and then putting it in your book. I seen one lady on live trying to teach y'all about medical building coding, and I really wish people would be specific in what they're talking about. Medical building coding is many things, but when it comes to your CPC exam, that is what you need to be looking for. Not nothing dealing with trying to code in a facility. So that's why I was trying to get y'all to understand, it's a concept thing. All right, now, have a good one. All right, so digestive system. Y'all got the codes for that? I mean, what was that? Okay, I ain't see her on her yet, V. Did V pop back up in the section? When she come back in, y'all, I'm stopping this real quick and go ahead and show her about the guidelines for ICD-10, because it's not going to take long. Did I show y'all the digestive system? Okay, they don't have modifiers. They don't have modifiers then. So you good on that. Again, digestive system. All you doing is whatever that test question asking you about, whatever location, anatomical location, that's all you doing then. That's all you doing. You looking up that, and then you go from whether if it's an excision, incision, repair, or whatever the issue may be, and then that's how you find your answer. Digestive system is very easy. Do not overthink it. For your urinary system and male genital system, your modifiers are modifier 22, 50. Don't forget left and right. 51, 52, 53, 58, 76, 78, and 79. These are your modifiers for the urinary system and male genital system. Please put that in your book. Screenshot if you have to. These are going in your book. Did V pop back up yet? If not, we're going to keep going till she pop back up. I know y'all at work. For the female reproductive system, you really don't have modifiers for it, but dealing with E and M modifiers applying to the female reproductive system, it includes modifier 25 when E and M service is performed. And then you got modifier 51, which is multiple seizures. So you really don't have no modifiers for it, but these are the modifiers that they have. Don't forget, modifier 25 is for E&M service dealing with the female reproductive system now. And see, the good thing about this, it tells you not to pin to E&M, radiology, pathology, and laboratory or medicine codes. And see, this book right here teaches you the same thing. If you want to know about your, hold on, let me go to it. Modifiers. It tells you how to apply your modifiers. It tells you where you can apply it to in the section. It tells you when to apply it, and it tells you where not to apply it. This is your Coder's Dictionary and Reference Guide. So, that's serious, y'all. Knowing these modifiers is serious. Cause they're gonna throw it at you on the test. Y'all were asking about test trick questions. That's one of them. When you on there taking the test, they're gonna have the actual code that's supposed to be the answer. Then they're gonna have that code with a modifier. They're gonna try to throw you off. Knowing the modifiers that's supposed to go into each section will help a lot. Let's see here. Endocrine. Alright, so with endocrine and nervous system, modifier 22. $24, $25, $26, and CT. Modifier 50, modifier 51, modifier 52, 53, 54, 55, 56, 57, 58. Well, I actually work 7 jobs, Magnolia Grace, so I came at a time that I can fit in my schedule. Modifier 59, 62, 78, 79, and don't forget your LT and RT. Y'all can screenshot. Again, if y'all can't make it to stay long, this video live will be going into my content videos. Also, you can purchase my books on how to prep your book. It's going to be on Etsy. I'm putting it on there today, so you all can be able to purchase it. For eye and ocular, I'm just going through the line for y'all now. These are your modifiers for it. Eye and ocular. Alright, V then came back on. So I'm getting ready to stop right here with eye and ocular auditory systems. These are your modifiers. Alright, V, so you back on. Let's go into your ICD-10 book. Let's get it. So y'all see I got mine's tabbed, okay? This is how you go into your guidelines. Again, remember I showed y'all CPT is different. CPT guidelines are different. And I'm for to show y'all. Anything that look like this in your CPT book is a guideline. Because guess what? It's telling you about the code. It say code 19-301 describes partial mastectomy. And it goes on telling you whatever it needs to tell you. Same thing over here. Anytime you see stuff like this, these are guidelines for your CPT book. With the ICD-10 book, it has everything already in the front of the book for you. This is just your coding and reporting page right here. This got all your chapters in it and everything you need to know, right? So say for instance, you looking for your punctuations. It's on G3. You see, it's just like a quick guideline for you to look at and see what you need to find. But let me show you something, V. We can put those modifiers in CPT since not all modifiers are in there. Yes. Yes. Alright, so for your guidelines, this is how I recommend any and everybody to use your ICD-10. I highlighted this. You got about 4 or 5 sections within this guideline. Guess what? Section 1. What do you see in here that's going to be on that test? Coding guidelines, right? Coding guidelines going to be on that test. This is a question that was on the test. Let me go closer to it. Manifestation codes was on that test. I don't want you being like me how I was when I first did my test, y'all. I'm going to tell you, I had a little slow moment. I didn't even think to go and use my guidelines. I didn't think. I'm going to show y'all what I did. I went to right here where symbols and conventions were, right? I seen manifestation codes. It was highlighted in this little baby blue. I called myself trying to go and find a baby blue highlighted code. Find a highlighted code that was in baby blue. Once I found that code, I called myself looking it up in the index. Once I found the actual code and I seen it, I seen use brackets in the index. That's what I did. I did it the hard way. It was right here for me all along. Brackets are used in the tabular list to enclose synonyms, alternative wording of explanatory phrases. Brackets are used in the alphabetic index to identify manifestation codes. If your test may be different and they ask about parentheses or anything else, it's right there for you. But I want you to highlight this because this is important. Guess what? They're going to be asking you about this. Anything dealing with convention and coding guidelines, it's right here. And I'm going to tell you something else. You got a guideline for that, right? And I made sure I highlighted these too because you're going to need to know general coding guidelines. Just in case they might ask you something about, acute and chronic diseases. And conditions you might not be too familiarized with it. At least you'll have it in these areas. See? They're going to ask you about combination codes. They ask you about stuff like that on that test. Chapter Pacific coding guidelines. This is where they get deeper into the chapters. They get deeper into the chapters with this. I put flaps right here because I want y'all. This is what I had went through with my test taking. So I'm going to share it with y'all. Test question. Please highlight it. Take a picture of it, however you want to do it. This is not a test question. I didn't see it on there. But this was a practice test question. STEMI versus N-STEMI. Non-STEMI. I highlighted this because this is test questions as well. They're going to ask about this. Being able to navigate through your book. Yes. V773, don't be scared of over highlighting. Over highlighting, I'ma just say it like this. If you do over highlight, have a highlighting color method. And Dana, yes, it was on practice A. This is on the test. This is on the test. So make sure you highlighting it. It's gonna be a true and false question of family and personal history of Z codes. You also can go to your Z codes and highlight it there too. Z codes. So this is just to show y'all how to use it. V, what's your understanding looking like with the guidelines of the ICD-10 book? Need more understanding? What we looking at? Hater dash natural. I just need to read them. But my ADHD is so gruesome. I'm gonna tell you something. I got ADHD too. I ain't even know that. I ain't even know you could be ADHD in your adult stages. But this make it much better. You gotta go through every last one of them. And the reason why I say that because they gonna ask you that on the test. This is part of the CPC test guidelines. They're gonna be asking about the conventions and coding guidelines of the whether it's ICD-10 or CPT. So that's why I'm telling y'all it's about navigation. Now, I'm solo dolo around here. I don't really fool with everybody like that. So I don't know nobody. I'll be out here kryptonite. But where was I? Cause I gotta finish showing y'all these. You welcome, V. And when y'all, I got everything. I got every book you can think of. Cause this is what helps pass the test. And V, Mama Bear has spoken. My mom said to drink you some black coffee.
No sugar, no cream.
No sugar, no cream. The
And
day of the
breathe.
test.
And breathe. Let go fear. And breathe.
Yes, Medicare and Medicaid, they're going to ask about that. It's important for you to know your Medicare parts. I'm going to show y'all what I did. Because I know I can't have the book in there about no Medicare. But this is what I did. I put it right here where my surgical section was. The surgery guideline. And bam. Part A, Part B, Part C, Part D. Because guess what? They're going to ask about this one. And they're going to ask about this one. And you need to know that. Look at Dana. Dana said, yes, they asked me a question like that. Yeah, I know. They asking them questions now. I'm telling y'all what's on there. Y'all got to be the one to listen now. I'm telling you what's on there. This is how I set my page up for anesthesia. Please know, y'all, it's two different coding when it comes to anesthesia. The anesthesiologist has a code method for them, and a CRNA has a code method for them as well. So y'all need to know the difference in reporting all that. MAC is monitoring, y'all. Make sure y'all putting this stuff down. I put key terms right here for me. I made sure I wrote these down: local, general, and regional. I made sure I wrote down the medical supervision direction modifiers that's reported with CRNA and the anesthesiologist, so I know. And then I did the same thing with reporting MAC, CMS, and other insurances. So y'all, when I write my notes to be understood. Cause one thing you don't want to do is go in there with some bull crap and then you don't know what you done wrote down. As you can see, these are my modifiers. This is what I was talking about when I say when you got free note pages, go in there and write your notes down. Just like on here. My biggest struggle at that time was within the integumentary system was the repair closure. I couldn't understand the difference between simple, intermediate, and complex repair codes. So I made a note section at the back of the integumentary system so I can understand. What I kept missing on the test was when adhesive strips and electrocauterization or chemical cauterizations are used as the only material for wound closure, it was reported as an E&M service. That what messed me up because I did not pay attention to that. I was thinking because it had the simple code ranges in there. I'm looking at, okay, it's a simple repair code then. No, if it got any one of these in there by itself as the material that was used for to close the wound, it need to be reported through E&M services. That's why when y'all, I don't know if it's on y'all test question, but on that test question, it had a 99 E&M code there, and I was wondering why. Did they have that there? That's what I had missed. So, hey, that's a little note taking for y'all. And I'm going to tell y'all something else. It was another code on there that asked about intermediate repairs. This is the tricky part about it. So we all know a single layer closure is a simple repair, right? They're going to ask you about a simple layer closure. But guess what? If it's contaminated heavily, wounded that requires extensive cleaning or removal of a particular matter is also represented as an intermediate code, repair code. So when I say I got the notes to really just help you, I have the notes, but you got to be willing to understand. I hope I'm making an understanding statement to some of you all on here. I really do. Because this is going to help you pass the test. The only way you can be able to pass that test is by really taking in this knowledge right now. It's really based off concept. You need to know your modifiers and medical terminology. Again, I wrote my medical terms up here for each section. Each section got their own medical terms. I wrote mine on each section because guess what? Oh, and they're going to ask y'all about this too. So y'all make sure y'all take this note down. Anything dealing with the skull, they're going to ask you about that. And they're going to ask you about this too. They're going to ask you about that. They're going to ask you what section it's in. Actually, they're going to ask you the section it's in. This is the section it's in. Musculoskeleton. It's going to throw you off now. I'm going to tell you right now. They're going to have a answer choice on there that say something dealing with I think cardiology. In the cardiology section, there's going to be another answer choice on there that's in the... Yes, you are breaking it down. I appreciate that, Jay. Thank you. They're going to have another section in there in the cardiology section because I think, if I'm not mistaken, give me 1 second to look at it. And this is how I have my stuff set up, y'all. So this is how I wrote all my medical terms down, too. I appreciate that, Merida. Did I say that right? Thank you, Tamara. Oh, even though I told y'all earlier to copy this down, they got a test question that's going to ask you the right ventricle. Where do the right ventricle go to, right? So I'm going to tell y'all right now, when that blood pumps up through here, it's being translated to be oxygen, okay? And then it comes through the left ventricle, okay? Remember, when that blood pump through here, it's going up to be clean, to get fresh oxygen, and it goes through the left ventricle. I appreciate that. I appreciate that, Dinah. Yeah, I give as simple as possible. People with ADHD don't do too well with folks be talking around the bush. I'm gonna tell y'all that right now. I'm one of them ones, I don't like nobody talking around the bush. Just tell me what you're trying to say. Anything talking about some stuff that going on, I'm gonna be like, I don't understand it. I don't understand it at all. It said my issue was also the order of organs, digestive system. Let's see where we at. Go here. Alright, so Bama, right here. This is a test question. The organs. They're gonna ask you about the small and large intestines. You need to know. I put this in green so I know that it's the small intestines, and I put it in pink for the large intestine. That's a test question. I think that's about the only organ question they asked about on there. If I think about it. Anything other than that, well, basically like simple stuff that I can just go to, from just looking at it. Like if they ask me something about the stomach, I go to my table of content, try to find out where stomach is at. Right up in here. That's where I go to, 366. I need to be trying to figure out if the question asking me anything about incision, excision, laparoscopic, or bariatric surgery. You need to know that. Earlier I was giving y'all the understanding of concept, right? The concept is knowing whether or not the anatomical site, which is the location, and then it said, are you in the CPT book? Yes, I'm in the CPT book. I know I'm switching both, y'all. I'm just trying to get y'all to understand what's going on. Cause thank you, D-Hack. But that's just a quick tip for y'all with the digestive system. The digestive system is really easy to pass, y'all. Please be careful. And when you're reading them questions, all you got to do is see what they talking about in that passage. Whatever they saying in there, you go and find it. If they talking about the anus, you need to go to the anus. And then if they asking, if they telling you that it was an incision made or an excision, endoscopy, anything dealing with that, you need to go in there and look at it, okay? That's how you break it down for you to take your test. That's how you do that. Anything other than that, you fine. Really, the digestive system is really easy to pass. Now, I'm going to tell you what was hard for me. I'm going to show y'all. I'm going to show y'all what was hard for me. This right here. That was hard for me, the male genitals. Because guess what? They asked me something about a doggone clamp. And I was trying to figure out what was they talking about. So basically, for circumcision, you need to use a clamp or a dorsal penile or ring block. But this is important. This is what I missed. So it was this code right here, 54-150, was performed without dorsal penile or ring block. And I didn't know I had to put modifier 52 with it. That what threw me off. Because I gave them this code, but they had this answer choice with the code right here with 52 on it, and I thought it was wrong. So, again, be careful on little small details like that, y'all. And then there was another question, too, that was talking about the circumcision, but they ain't say repair on it. But I knew if it was not fully completed and it was incompleted, then I put repair on there. So I'm going to just let y'all know that right now. Dana, lab and path case study was hard for me. Let me show you Then hold on, Dana. I got you. Give me 1 second. I'm gonna pull this up for you real quick. And again, y'all, for those who don't know, I'm sounding like this because I'm sick. But I got y'all. Give me 1 second. Pathology and lab. So pathology and lab. Your coding concepts are type, number, complexity, with and without, okay? Please take a picture of that if you got to screenshot it. Without, complexity, number, and type. That's your coding concept for that. Let me show you these. For your most common procedures, you need to be looking at these. Take a picture of it. Go through all these. You need to go through all these sections within the pathology section. And if you go to it, let me go to it in my book too. Give me 1 second. So I'm gonna show you this together. You see that? To be honest, when you taking your test, Dana, it gonna tell you what it's looking for anyway. Cause guess what? When I was taking my test, it said something about third period drug assay. I ain't know what no assay was. I'ma just be real with you. I ain't know what that was. I thought they were talking Spanish to me. But they were asking about a drug. So when I turned to 626, let me see. Cause 626, there you go. Where that question was. Here you go. It's up in here somewhere. Can we find the computer screen portion? Oh no, that's my class course. I'm teaching y'all from my class course so y'all can know what's going on. Cause they gonna charge y'all. It's about $3,000 to $4,000 for the class course. Some people don't want to get in debt. Some people don't have the money right out. But I'm just letting y'all know. Hold on. I was trying to see what that question was. Here you go. It asked me about this one. 8143. And then remember now, for the definitive drug testing, this is where you go to. It's real simple. So Dana, it's real simple. So I'm gonna tell you something. It just like the digestive system section. You look into the test question, whatever that test question asking you, whether it was talking about vaccines or something. Let me show you where it is. Vaccine. I seen it somewhere. Is it on the front page? Because they asked about that too. They asked about a vaccine. I didn't really have to do any much writing in this because I was able to just catch on right then and there. Let's see. 689. I'm going to just check this page out and see. Because they asked about a vaccine. I do remember that. My brain pretty good. Right here. They're going to ask about these right here. 86001, 86003. You got IgE and IgG. This one right here is crude allergen extract. Each. Then you gotta be careful because the question might ask you. It say, this is great. I did self-study. Went for the exam, didn't pass. Only got 68 points. Hey, Samantha, that ain't bad. That ain't bad at all. 68 points. You right there. What a 70% at? That mean you know your stuff. That's all that is. I didn't do good with the layout questions. Yeah, only that close, yeah. It seemed like it's stressful, but y'all, it's really a concept thing. And I'm telling y'all right now, when them test questions hit, let me see real quick, y'all. Let me see what I got for y'all. I'm gonna see. Hold on. Y'all gonna be just staring at the book now. Hold on. Let me see what I got for y'all. I'm gonna show y'all what I'm talking about. Oh, just in case y'all don't know, they might ask y'all questions about LCD, ABN, medical necessity. They're gonna ask y'all questions about. It's gonna be like a test exam. On the CPC, it's gonna be a question that they gave Dr. X, Dr. Y, Dr. Z, patient, whatever the patient letter alphabet was, went to Dr. X office, or they a new patient or established patient. It's gonna be a question like that, y'all. So y'all make sure y'all watching out for these things. Get acquainted with E&M services. E&M services, I'm gonna tell y'all right now, if you having problem with E&M services, get the Coder Dictionary and Reference Guide. And I'm gonna tell y'all why. I'm finna show y'all. Is it in the back of the book? Let's see. Yep. There you go. It's called E&M Survival Guide. It gives you the understanding of E&M basics, new and established, initial versus subsequent patients, levels. Y'all, we know we have a problem with them levels. Determining code levels based on MDM and based on time, knowing older guidelines. Time, knowing older guidelines. It gives you a list of things to go in and understand about, okay? Let me show y'all. So it tells you your definitions. This is good because when you were doing AA, I don't know if y'all doing it, but some of us do AAPC practicals. That is our work from home. So when you're doing practicals, you need to know what that chief complaint is. You need to know all that, because guess what? It's going to tell you all about the family history, the history of present illness, past history, social history. It's going to tell you all about that. You need to know about a new patient. All this is in your book already. Let me go to it. I might need to take a break so I can go blow my nose. I don't want to be sitting on here sniffing up boogers. So, let's see here. Alright, so all this, y'all, they're going to be questioning you on this and this one right here. So make sure y'all take these notes too. CPT surgical pack definitions. They're going to ask you about that. They're going to ask you about the separate procedures. Whatever answer choice they got modifier 70 something in it, or whatever the answer is, that is wrong. That is incorrect. That is the wrong answer choice. So that would be the one that you mark down as false, okay? Ding, ding, ding. Test question answer. Alright. Right here. Remember I was telling y'all about they're gonna be asking y'all about Dr. X didn't come in, so Dr. Y took over the patient and this patient such and such. This right here, you need to be highlighting it because it's going to tell you about the new patient and established patient. If you're not understanding how the decision tree for new and established patient work, this is basically who received any professional services from the physician within the past 3 years, basically. And that is how you determine if they're a new patient or not. I know some people had a hard time with trying to understand the actual E&M services of the decision chart. Y'all, right up in here where it say levels of E&M service, you need to highlight the level M&D, MDM, and the total time. The guidelines for selecting level services based on medical decision making are 3 elements. I highlighted them. You need to know the number and complexity of problems. You need to know the amount or complexity of data being reported or analyzed, and you need to know the risk of complications. But it tells you everything through here. You gotta read. Alright, the number and complexity of problems. So this is your chart for MDM of medical decision making. This is how you determine low. If it has 2 or more self-limited or minor problems. And right here you will see problem. A problem is a disease, condition, illness. It explains everything to you right up in here. And it goes all the way down to high. Guess what? On this page, it keeps going. Because it's telling you everything you need to know. Minimal problems. It tell you about self-limited problem or minor problems, right? Because I'm going to just show you. So right here for low, it has to have 2 or more self-limited or minor problems, right? Self-limited or minor problems. A problem that runs a definite or prescribed course. Is transition in nature and is not likely to permanently alter health issues. Alright? Right here. It say it gotta be one stable chronic illness or one stable chronic illness. Let's see. Stable. There you go. Stable chronic illness. Expected duration of at least 1 year or until the death of patient. Like uncontrolled diabetes or controlled diabetes or a single chronic condition. You see? It gives you everything you need to know. You just have to read the chart and then go to the next page and look those things up that it's telling you for right up in here what you need to be doing. Y'all, it's 9:43. At 10 o'clock, I'm done. I hope y'all took in a lot. Some more information for E&M. So basically, y'all, and I'm going to tell y'all, I know these are in the front of y'all books. But it's a prefix word sub. You need to put that somewhere up in here that you can remind yourself because they're going to ask you about that. You doing this every Monday? Please say yes. No, Cheryl, I'm not. I just took the time today to actually try to show y'all what I'm talking about so y'all can understand what's going on with the CPC. I appreciate that, Jay. I have a lot going on too, y'all. I have kids, I work, and I code for myself. And that's another thing I'm gonna be talking to y'all about too. I want to talk to y'all about that. Give me 1 second. All right, y'all. So when you working from home, you can. I'm just say this. Once you get your medical billing and coding certification, they always try to tell you that you have to be within that field for 5 to 10 years before you can start working from home, like doing your own thing. When I say doing your own thing, it's not working for yourself. You can work for yourself. The only thing is you need to get you an LLC. Cause I'ma just say this. You need to get that LLC. Research what an LLC is. And also research about what you can do as a medical billing encoder on how to charge. If you worked in a hospital setting like I have before, then you know that you're not going to get paid to your standard. Have you ever heard of being overly qualified? Me personally, it was new to me because I was like, what do you mean overly qualified? Meaning that that's their nice way of telling you that they're not going to pay you for having all the experience that you have. It don't matter if you've been in college for 9 years like I have. It don't matter if you got your PhD. It don't matter if you sat up there and you've been working in this field for 5 and some years plus. It don't matter. They don't want to pay you 35 and on up. That's okay. LLC. You can charge them by the head count like a doctor on how many patients you're coding for, or you can do hourly base. Look into it. I teach y'all this because I want y'all to understand. Also, if you are a self-paced student and you're dealing with AAPC and you are trying to practicode is your job. You get 600 practicodes. Get on there and learn it. What I did was I print my stuff out. I printed my stuff out. I filed it. I went through and I studied my stuff like it was an actual chart. You see what I'm saying? Learn how to do it, because what Practical do is they give you the medical record. And they give you the answers to it. You'll be able to see your answers and then you'll see their answers. They give you what do you call it? They give you how they got their answers. The code ranges, the section, how they got it. They do all that for you. So I'm telling y'all this because it's so many benefits with these. You can retire early with these. Don't let the test distract you. Don't let people distract you. But I tell any and every one of you all this. It's harder when you allow people to determine what's for you. And what I mean by that is, when y'all sit up there and y'all be watching all these different folks talk about coding, you're doing wrong. Your main objective was to go in and research yourself, because as a medical billing encoder, that is what we are. We are medical researchers. We go in and research. We are telling the story of that patient. And we cannot do that if we sitting up there looking at everybody else's notation. A lot of these folks be sitting up here. I've been watching their lives. I've been watching their content. And I've been hearing it all through the years. Y'all, stop following and copying people's notes. It's not hard. It's simple. And if you with AAPC, they give you all the materials that you need. Some of the materials that you will have to buy, like the Coders Dictionary and Reference Guide. You will have to go and buy that underneath the reference guide. Books in the shop. They gave me the training manual through ebook, but I asked them for an actual copy, so they put it in my cart and I paid for it. It was $135 in all. That's with taxes included, but the book itself is $109. So I don't know what your taxes may be like, depending on how close you are to them or how the FedEx thing work. So again, I want y'all to be confident enough not only to just take this test, but to know who you are and what this gonna benefit from with you. Okay. Another thing is book prepping. You can highlight as much as you need to, but understanding what you highlighted is very crucial. Like, I'm so serious. You need to know what you're highlighting. So if you need a color code base, do so. If you want to copy the method, hey, how you doing? All right. If you want to copy the color method that I did for my highlighting, then you can do so. But the main thing is knowing what you're coding. See, the highlighting is for you to highlight your concepts. Is what I was talking to you about earlier, which is with or without, complexity, time, number, the anatomical location, the site, size, the device, depth. It talks about all these. That is what the highlighting is for. That way you can go ahead and find whatever you need in your test question. If your test question is talking to you and you're in the musculoskeletal section and it asking you about the thorax, you know you're not gonna go and highlight something for cervical or lumbar. So you have to highlight based on what it's asking, because when you get ready to take that test and it asks you a specific question on to find something, that is what it is. So that is my whole point of this. Thank you, Haynes. I can't even say your first name. I think it's Reseller. But I just want y'all to be aware of what's going on and understand. I do know a lot of people get very egotistical when it comes to making money or doing having a great career, but it ain't this over here. I want y'all to understand how this go and make it, because I didn't have nobody to do this. Everybody that I had trying to teach me was telling me in my face, because I didn't know no better. I'm going to just tell you, my mom is the one who coached me and talked to me about putting my heart into things a lot of times. That lady sat up there and told me, you ain't finna take my job. You need to do all that on your own, research on your own. That's what she told me. And it hurt my feelings so bad, because I was like, what did I do to you? Like, you supposed to be my teacher. You supposed to be trying to help me. Instead, you telling me that I'm going to take your job. My mom letting me know she was intimidated, because she wouldn't have no business saying it if that wasn't the case. I done had teachers with instructors and professors where I was dealing with drafting designs in engineering, because I used to build the engines. I had professors telling me that was a band field and I need to be behind a desk. I need to act like a woman. That was a man's field I was in. And it's so crazy, because when I got older, guess what? I realized that it was more women in that field than anything. Just like it was men, it was women in that field, and they were the project managers. They was the one over them. So I'm going to tell y'all something. Don't let people deter you away from what you want to do. Don't listen to everybody, because when you listen to everybody, you get wrong with them. And it hurts you more than anything, because I'm going to tell you, with this field, it's a doggone good field. So the more you delay in it, the more you delay your time. I appreciate that, V. Look, I'm just trying to help y'all. But I'm going to also say this. I had to learn, too. Sometimes when you get detoured in life, it was for a reason. Never question God. Never question God. Your detouring in life comes because sometimes it's something down that road God was trying to protect you from. I found that out the hard way. So that's why I'm going like I am for y'all. I'm an entrepreneur to the heart for a reason. Because my story, you probably wouldn't even understand it. But some of y'all, I want y'all to understand, don't let people throw you off. Sometimes you need that detour. Sometimes that delay in life is needed. Because you don't know what was down at the end of that road, baby. I'm going to just tell you that right now. I had folks plotting and planning on me, and I ain't even see it coming. Because I'm just so happy. I'm full of energy. I'm full of love, peace, cool, calm, and collect. I'm vibrant. Never once did I see it coming. But God give us the discernment. Sometimes you just don't listen. And I was one of them. I didn't listen. So things happen. But I just want y'all to be careful on it. Be careful on how some of these snakes out here changing colors to get up close to you. And then they turn around, they ready to size you up. See, I took zoology too, so I'm going to let y'all know when a snake not eating, they getting ready to bite you. They getting ready to feed off you. That's why they getting so close and snugged up on you. They wrap around you like that because they trying to see how much they can fit in you. Be careful, y'all. There's some snakes out here. They tell you stuff to throw you off. I had people that were being spiteful racially. Take my test, couldn't pass it, but I was passing. I'm just telling y'all, don't let folks throw you off. The whole thing is to prove a point and to make that point. You gonna get it. All y'all gonna get it. If y'all follow the concepts, all y'all gonna get it. And you ain't gonna fail. Your concepts is not gonna lead you wrong. That's the true meaning of coding. Your concepts are not gonna lead you wrong. Only you can lead you wrong if you sit up there and you overly think about it. Overly thinking can get you wrong. Because guess what? What they always tell us, that first thought is the right thought, right? If you thinking all the other thoughts, you're going to get thrown off from that first thought. So, I hope y'all pass your test. I ain't gonna say I hope. I know y'all gonna pass y'all test. If y'all took these notes down there, y'all gonna pass that test. I know that for a fact. You gonna pass that test. And if y'all don't pass, I know y'all gonna make it close to that 70%. I do know that. And if you already at that 70% mark, 2 points from it, 5 points from it, you gonna pass the next time. Because now you got the true answer to what you're trying to do. And it's called concepts. It's 9:57. I'm finna put this phone down, get my baby because she done went to sleep, and gather my books and stuff, and we about to hit the road. But it was a pleasure being out here with you all. And I appreciate y'all for doing what y'all doing.
Mama Bear.
And Mama Bear wanna tell y'all thank y'all too.
You guys gonna do great, so don't worry. God got you, okay? So if you really want something, he said, I will bless you according to the desires of your own heart. So trust that and believe. Everything in this life, I said it before, is a mirage. This is nothing too hard for God. If you want this in your life, want to succeed, you will succeed. You ask him first. Go to him, ask him first to guide and to lead you. It got to be for the right reason, you guys. Don't ever forget the real reason why you want this so bad. You are a researcher by heart. You are a caregiver by heart. And that's what God loves. Even in the word, we have to research. Even in the word, you have to love and care enough for the next person in order to show love back to him. So my daughter has done something wonderful and great, and I can't express enough how proud I am of her. She is an entrepreneur. She is basic. The young lady is so humble. She go to house cleaning with me. She does laundromats with me, and she works for herself. And she cares enough for others, what the instructors won't do. She went above and beyond to make this possible for you all, so you won't get robbed. Because they charge you so much, in the thousands, for us to have this information. And she is handing it to you. She giving it to you. So please take advantage of this. Nothing too hard for God. Love you guys. I know you're going to be a success. And you keep striving. Everything that you want in this life is yours. Go, girl.
All right, y'all. 10 o'clock. Thank you, Samantha. Thank y'all, Dana. Jay, I appreciate y'all. Y'all have a blessed rest of y'all day.